So I'm happy to be here today. The title of my presentation is Making Sense of Nutrition Confusion. What should I eat to optimize my heart health? So before I get started, just a bit of background about myself. I'm Mi'kmaq and I'm a member of Eel Ground First Nation. For those of you not familiar with Canada, Eel Ground is in New Brunswick, which is on the east coast of Canada, right near the Miramichi River. I've been in Seattle now for 16 years at the University of Washington Department of Epidemiology, where I focus on nutritional epidemiology, physical activity, and American Indian health. And I've always been interested in public health and prevention of diabetes and heart disease. And this is because as a child, I experienced firsthand the impact of these diseases on my community. And I'm really committed to better understanding and developing appropriate interventions that can be implemented in rural communities and American Indian communities to optimize health. So I gave a coffee hour last year. I'm sure some of you attended. And I talked a bit about some work that we're doing in the Strong Heart Study to learn about the relationship of diet and health outcomes. And at that time, I gave some tips about healthy eating and staying active during the pandemic. Things like practicing mindful eating, paying attention to portion size, and making small changes in diet and activity levels just over time. And during the Q&A session, there were a lot of different questions about different types of diets and eating patterns. So this time around, I thought I'd focus a little bit about dietary guidelines, what they are, what they mean, and then a little bit about fad diets that I'm sure many of you have heard about in the news and in magazines and TV. And I know that health advice is constantly changing. One day we're told to avoid saturated fat, and now we're told that some forms of saturated fat are good for us. And these constantly changing recommendations could be very confusing. And that's for everyone, even for scientists who focus on nutrition. So hopefully this talk will help clarify a little bit about why studying diet is complicated and why we get these mixed messages, and also what the current science is for telling us about what types of food we should eat and also about what types of food we should avoid. So studying the relationship of diet with diseases, it may seem trivial, but it's actually really quite challenging. Diet it's complex. In disentangling one dietary component, one food and one nutrient from its associated with the disease from another food and nutrient is very, very complicated. And there are a lot of different issues. So the first issue that scientists face is the relevant time period when diet is important. And this is really unclear. And it probably varies based on what your outcome of interest is. So the relationship between diet and cancer, or diet and heart disease, or diet and diabetes. What time frame diet is important for those outcomes is just unknown. So is it your current diet? Is your current diet what's important to prevent heart disease? Is it the diet you had 15 years ago? Is that what's most important for future disease prevention? Or is it the diet your mom had while she was pregnant with you? And there's a lot of variability, and again, it probably varies based on what disease, what outcome you're interested in. Another question that we're faced with is, what part of diet do we look at? We have nutrients, things like vitamin D, fat intake. We have foods, things like fruits and vegetables, pop, processed foods. And then we have dietary patterns. So, overall, how are you eating? Are you generally eating a healthy diet or an unhealthy diet? And it's pretty unclear about where we should be focusing our efforts. There's been a shift, and I think it's a good thing, towards really focusing on the global effect of your dietary patterns, since foods and nutrients they're not consumed in isolation. So the way the scientists move right now is just thinking about, on an average day, do you eat a healthy diet pattern or do you eat an unhealthy diet pattern? Another issue, which I think that a lot of people don't appreciate, is related to nutrient composition tables. So when you measure diet in a research study, or even when you're developing nutrition facts information, you use these food composition tables to figure out the nutrition in different foods. But are they accurate? So not all fruits and vegetables are identical nutritionally, even within the same food item. So there's a lot of variability in nutrition based on the breed of a plant, the age at which the plant is harvested, the color, so orange carrots versus purple carrots, how much sunlight the plant had, the feed that it was given, how long it was stored. You know, by the time food gets to the grocery store, sometimes it's been sitting for months, you know, for things like apples, and nutrition could decrease over time. And also how much heat and light it was exposed to. So in other words, not all apples are created equal, not all broccoli is created equal. There's actually variability within foods. Another complication is about environmental health. So last week we heard a presentation about environmental health, and where your food are grown has health effects. So some foods have agricultural chemical contaminants, and in developing countries, aflatoxin, which is a fungus, can contribute to high rates of liver cancer. So it's not only what the food nutrient composition is, but where it's grown, you know, what types of chemicals are used, and what's around it. How you prepare food also influences the chemical composition. So, you know, for processed meats, I do a lot of work with meat intake. And in processed meats, there's some chemicals that are called nitrates that are formed when the meat is being processed, and those could have health outcomes. So all of these factors really contribute to uncertainty when doing studies to try to understand foods and nutrients and diet patterns that promote health, and foods and nutrients and diet patterns that impair health. So even though we have some uncertainty and we have some challenges measuring diet, diet questionnaires have been shown to be a decent marker of usual diet quality. And food questionnaires have been given in many different studies, including the Strong Heart Family studies. So some of you who are participants may remember, you know, way back in 2001, and then again in 2007, you were given a questionnaire to fill out that asked about usual consumption of 119 food items, and you had to document how often you eat the food as well as your portion size. And using that information, we were able to get a snapshot of what the usual diet pattern of the population looks like. This slide here is showing the usual consumption patterns for both the participants in the Strong Heart Family study, which is shown in red, as well as the general US population, which is shown in green. And you know, based on this information, we know that data quality for all Americans is generally quite poor. So most people are not eating healthy diets, and there's a lot of room for improvement. So in the Strong Heart study, about 4% of participants were consumed at least 4.5 cups of fruit and vegetables per day. Less than 1% of people consumed 2 or more servings of fish per week. No one consumed 3 or more servings of whole grains. About 14% consumed less than 1,500 milligrams of sodium per day. About 29% consumed less than 36 ounces of sugar sweetened beverage per week. So that's things like pop and fruit drinks. About 35% consumed 2 or fewer servings of processed meat per week. About 2.5% consumed accumulated less than 7% of their total calories from saturated fat, and about 23% consumed 4 or more servings of nuts, legumes, and seeds per week. And this is pretty similar to the general US population. So, you know, so diet is poor, but, you know, there is a lot of room for improvement. So we also know from research studies that a healthy diet, an unhealthy diet is a top cause of premature death. And obesity, high blood pressure, and diabetes is a struggle for all Americans. And the burden of these diseases and these risk factors is continuing to grow. So in the Strong Heart study, about 84% of participants were either overweight or obese. 39% of participants had high blood pressure, 45% of participants had diabetes. Given that we know that unhealthy diet is associated with all kinds of adverse health outcomes, we really need clear science-based guidelines to maximize health. So, there's lots of different dietary recommendations. I'll talk about them today, but pretty much one of the most popular ones is the USDA dietary guidelines. So essentially, the USDA provides these science-based dietary guidelines for Americans that are intended to help prevent heart disease, to help prevent cancer, diabetes, and other chronic diseases, as well as to promote health. And these guidelines are what's used for the foundation of federal nutrition programs. So things like WIC and commodities, and then nutrition education, SNAP-Ed. They come out every 5 years. And the most recent version was released at the end of 2020. And you can find it online. If it's a very big document, it's about 150 pages. So I'm just going to give you the highlights here. So the guidelines comprise different recommendations, the top three being to follow a healthy eating pattern at every life stage. So this includes infants and toddlers, children, adolescents, young adults, and elders. The document also gives special information for pregnant women and breastfeeding moms. The second recommendation is to customize and enjoy nutrient-dense foods and beverages. Choose foods that reflect your personal preferences, your cultural traditions, and your budget. And then the third recommendation is to make every bite count. So choose foods that are rich in nutrients and not empty calories. And for this recommendation, the focus is on eating a variety of foods and beverages within larger food groups. So things like vegetables and fruits, grains, dairy, protein, and oils. So in a nutshell, follow a healthy diet pattern, eat a variety of foods, and choose foods from all the different food groups. Another thing that's highlighted here is portion size. So portion size is really important, and just to be conscious of how much you're eating. So based on these USDA dietary guidelines, the USDA created MyPlate to target the general public. And some of you have probably seen this graphic before. So the graphic is really portraying all of the dietary recommendations of the USDA with a picture. So essentially, the recommendations are to fill half your plate with fruits and vegetables, half of your plate with a quarter of your plate with grains, and a quarter of your plate with proteins. And then you can also add in low-fat or fat-free dairy products. And it's not really depicted in the picture, but also, eat less sodium, saturated fat, and sugar. So IHS has their own version of MyPlate, and this is called My Native Plate. And it follows a similar format. My Native Plate, it has a more emphasis on vegetables and less on fruits. The dairy that's in the regular USDA MyPlate is incorporated into the protein category in My Native Plate. So things like yogurt and cottage cheese, if you're not lactose intolerant, can be included in the proteins here. And essentially, both MyPlate and My Native Plate are encouraging eating more plant foods, eating less meat, and avoiding ultra-processed foods. This includes things like chips and sugary beverages. I think one of the key points of these dietary recommendations, both MyPlate and My Native Plate, is to really focus on your total diet pattern rather than on individual nutrients. And this is really important. There's been some appeal in being able to take a pill, so to take a dietary supplement to maximize health. For instance, beta carotene is considered a healthy nutrient that's in orange vegetables, things like carrots. If you don't like carrots and don't want to eat them, can you just take a beta carotene pill to get the same health benefits that you would get if you ate carrots? For most people without specific vitamin deficiencies, that have been diagnosed by their doctor. In that case, supplements could be very important and life-saving. The answer is that, taking individual nutrients as a pill don't really affect your health in a meaningful way. And I'll give you some examples. So the first one is the CARROT trial. And this was done to test the effects of taking antioxidant vitamins on risk of developing lung cancer. And the focus of this study was on two populations that were at high risk of lung cancer, so asbestos workers as well as heavy smokers. And the study was done because there was some evidence based on epidemiological studies that individuals who consumed a lot of orange vegetables, so carrots, red peppers, things like that, had a lower risk of lung cancer. So this study was started to really see, is it the beta carotene in these orange vegetables that's lowering lung cancer risk? So the study started in the late 80s and it went on for 8 years. And it had to be stopped early because the researchers found no benefit of the antioxidant supplements on risk of cancer. And in fact, the folks who took the supplements may have actually had an increased risk of cancer as well as mortality. Another example of this is omega-3 fatty acids. So there's been a lot of work in this area. So consuming fish, particularly fatty fish, things like salmon, has been shown to be very protective. It's really good for your heart. Folks don't like fish. Can they take an omega-3 fatty acid supplement to have that same benefit? And the omega fatty acid supplement won't harm you, but the findings in most studies have been pretty null. So it probably doesn't have much of an impact on your risk. And this is kind of an interesting thing. So it's like, well, why do we see that? Why is consuming a vegetable or a fish or a fruit that has specific nutrients in it associated with better health, but taking the pill that has this active ingredient that we think is driving, that association is like has the benefit? Why isn't that associated with a better health? And there's many reasons for this. The first is that nutrients travel as food packages. So, in fish, it's possible that omega-3 fatty acids are the correct active ingredient that promote health, but there's something else in the fish that we don't know, and that's working with the omega-3s to produce the health benefits. And then we have nutrients in foods. Sometimes there's things people eat are very close to each other and they travel consistently. So it's really difficult to tease out which food is associated with the disease. So for instance, a lot of folks who eat high fat diets, their diets are also high in calories. So is it the fat, that's associated with poor health, or is it the large calorie intake that's associated with poor health? It's really hard in this situation to separate out the fat intake from the total calorie intake. And in the same area, it's like, folks who eat a lot of fruits usually eat a lot of vegetables. So how do you tease out, is it the fruits or is it the vegetables that's promoting health? So, there's a lot of uncertainty in this area, which makes it a very challenging area of research. But even with these challenges in measuring diet in the population, there's overwhelming evidence to suggest that following a diet that closely aligns to MyPlate or MyNativePlate, including in a wide variety of vegetables and fruits and proteins and grains, will positively impact your health, the health of most people. And I think one of the appealing things about MyPlate and MyNativePlate is that it's flexible. It focuses on food groups rather than individual food items. So there's many options to choose for all people, whether you live in a city or the country. If you primarily eat canned food or frozen foods or fresh foods, you could still use MyPlate as a guide, for healthy eating. And the idea behind this is that one size does not fit all. So we all have different food preferences. We all have different cooking abilities. And, quite frankly, nobody likes to be told what to eat or how to eat. So using MyPlate as a foundation you can look at how you eat, and then you can decide what you're able to change, what you're able to cut back on or add, to really try to align your diet with the current dietary recommendations. So My Plate is USDA guidelines. So there are some other diet patterns that are quite similar to My Plate that have been shown to be associated with health and longevity, including low risk of heart disease and diabetes and obesity. And one of the most popular ones is the Mediterranean diet. And this is a popular plan that includes eating a wide variety of foods that are really in line with My Plate. So the Mediterranean diet follows a pyramid and not a plate, as My Plate or My Native Plate. But it emphasizes eating whole grains, fruits and vegetables, beans, nuts and seeds, and some lean meats and fish. You know, in the Mediterranean diet pattern, olive oil is the primary source of fat, and it encourages you to eat some dairy products, primarily cheese and yogurt, and fish and chicken can be consumed in low to moderate amounts. You know, you could eat eggs, probably up to 4 weekly, and then you also have red meat consumption here, which is in low amounts. And, you know, unlike a lot of the diet plans, there's no set calorie range or limits on portion size with the Mediterranean diet. So it can work well for a variety of folks with many different types of lifestyles. We also have the DASH diet, and this is another popular eating plan that you may have heard of. And it was designed to lower blood pressure, but it has been shown to have many health benefits for everyone, even if you don't have high blood pressure. And it incorporates vegetables, fruits, low-fat dairy products, along with whole grains, lean meats, and nuts. It also has, you know, because it's focused on blood pressure, it also sticks on some sodium guidelines in an effort to reduce high blood pressure. So, you know, it's kind of similar to the Mediterranean diet, eating a lot of vegetables, fruits, and whole grains, eating low-fat dairy products, fish, poultry, beans, nuts, and vegetable oils. The diet asks that you limit foods that are high in saturated fat, things like fatty meats, full-fat dairy products, and tropical oils such as coconut palm oils, as well as limiting sugar-sweetened beverages and sweets. And you know, what separates the DASH diet from the Mediterranean diet is that, you know, the DASH diet has the focus on sodium, and the Mediterranean diet also allows for some red meats, where the DASH diet recommends avoiding red meats. And the DASH diet also gives serving recommendations, so it's a little bit different than the Mediterranean diet, which has no information about portion sizes. And then, of course, we have the American Heart Association guidelines that are part of Life Simple 7 to promote optimal heart health and reduce mortality from heart disease. So again, this is pretty similar to DASH. So in green are the foods that are beneficial, and then in red are the foods to avoid. So again, eat lots of fruits and vegetables, fish, whole grains, and nuts, legumes, and seeds, and avoid sodium, processed meats, as well as saturated fats. So I think we can all recognize a pattern here. So there's a lot of commonality between the My Plate, My Native Plate, the Mediterranean diet, the DASH diet, and the American Heart Association guidelines. They really emphasize eating a wide variety of foods from various food groups. And all of these diet recommendations or diet plans have had a long history where it's been demonstrated to promote long-term health benefits, you know, lowering risk of heart disease, lowering risk of diabetes, lowering risk of obesity, and lowering risk of death. There are also some popular diets that are less well studied, including the keto diet and the paleo diet. And you know, there's many others. There's hundreds of different types of diets, but these ones I've seen in the news a lot recently, so that's why I decided to focus on them. And you know, I myself, as an epidemiologist, having critically read studies in this area, I'm not an advocate of these diets. They're pretty narrow focused, and for most people, they're difficult to maintain in the long term. Also, you know, there haven't been any good long-term studies that show how these diets over a long term impact health. There's been lots of short-term studies, 1 to 2 years, but nothing that goes beyond a couple of years. So the keto diet. So this has gained a lot of popularity over the past 5 years. It seems to be the popular Hollywood fad diet at the moment. So it's a diet that's very low in carbohydrates and very high in fats. And it was actually developed to treat a severe epilepsy in infants and children, and it works really well in that context. The goal of the diet is to enter a state of ketosis, and that means that it's a state where your body burns fat instead of glucose for energy. The diet entails limiting carbs, the carbohydrate intake, to between 20 and 50 grams per day. So that's quite low. So, if we go back to my plate, really recommends getting half of your calories from carbohydrates. So based on USDA and recommendations or My Native Plate, you should be getting about 275 carbs a day. So going from 275 to 20 is quite drastic. So with the keto diet, there's really no bread, no pasta, no rice, no potatoes. This 20 to 50 grams of carbs, you get it from having a very tiny amount of non-starchy vegetables, things like spinach or broccoli or tomatoes, for instance. But again, it's very, very small amounts. Also, protein is limited as well. So it's kept high enough to maintain your lean body mass, but low enough to preserve the state of ketosis. So essentially what you're doing is you're pushing your carbohydrate intake so low that your body has no choice but to burn fat for fuel instead of sugar. A lot of folks feel like this is like the holy grail of the fat diets. Research does show it has benefits for improving insulin sensitivity in glycemic control, and also you get reductions in your appetites. So it's popular. It works in the short term. You lose a lot of weight, your blood sugar improves. But with fat intake that's so high, your LDL cholesterol also increases. All of the studies on this diet are so short. It's 1 to 2 years. So we don't know what the long-term impact of this diet is on your heart. Also with this diet, vitamin deficiencies are a problem, just because it's so limited in the types of foods that you can eat. So currently, the diet is not recommended for most people in the long term. It's not a diet that one can sustain. And again, one size doesn't fit all. So for special populations, this diet works. It should be stuck with, like, for instance, severe epilepsy in kids. But for the general person, it's not a diet that is really sustainable in the long term. Okay, the other fad diet right now is the paleo diet. So I'm just going to say first off that I'm a big advocate of incorporating traditional foods into your diet. This is very important. It's very healthy. So, if you come from my community in Canada, this means incorporating, some meats, things like moose. My dad was a very big moose hunter, or some plants that can be locally foraged, things like blueberries, in the summertime. If you live in South Dakota, it might mean incorporating buffalo, prairie turnips, things like that. So traditional foods are healthy. They promote good health outcomes. But this is not to be confused with the paleo diet. So the paleo diet is a prehistoric human diet. So essentially what people ate 10,000 years ago. So this diet really focuses exclusively on foods that can be hunted, fished, or gathered. So essentially meats and fish, some fruits and vegetables, nuts and seeds. What it also means is that there's no grains, no legumes, so no berries, lentils and peas, no dairy, no sugar, and no salt. And the reasoning behind this diet is that, folks, who thought about this feel that the human body has been genetically mismatched to the modern diet that emerged with farming practices. But the exclusion of whole grains, of legumes, of beans, and of dairy, it's not well supported in nutrition research for most people. So these sorts of foods are nutrient rich. They contain important vitamins and minerals. And eliminating them, from your diet is not going to ensure long-term health. They contain fiber, which has been shown, in research to reduce the risk of heart disease, certain cancers, and type 2 diabetes, as well as other health complications. Another thing is that with any diet trend, the paleo diet may be really hard to sustain because you're eliminating entire food groups and types of food. And, we live in a society where it's not possible to eat exactly how our ancestors ate. Wild game is not as readily available as most meat sources. Most meat sources are domestic. So to do this on a mass scale is quite unsustainable. So just a couple tips, in closing. I think, for most people, fad diets are not sustainable and may lead to nutrition deficiencies, and the effects on long-term health are unclear. Variety in your diet is important. There should be no foods excluded from a healthy diet, because a healthy diet is one that you can maintain for your entire life. If you like bacon and eggs for breakfast, have it once a week, but not every day. If you like Pop-Tarts, have them once a month, but choose healthier diet options, for breakfast most of the time. Things like whole grain cereal, like Cheerios or Bran, for most of the days of the week. Another thing is to, pay attention to practice mindful eating, and to pay attention to why you're eating, what you're eating, how you're eating, how much you're eating. And I really feel that it's important to eat with family and friends when possible. This is important for social connections. It also minimizes distracted eating. So that happens when you eat in front of a television or a computer. I find myself doing that sometimes. We all live busy lives, and a lot of times when you do that, you just lose track of how much you're eating. Another thing is to, given the burden of heart disease, to limit sodium as much as possible. And when people think about reducing sodium, they often think about the salt shaker, but it's really processed food that's the problem. So only 5% of your total sodium intake comes from salt that's added while cooking, and 6% comes from salt that's added when you're eating. But 77% of sodium in food comes from processed foods and prepared foods. So, try to avoid the microwave dinners, the pizza, the chips, the canned meats. And if you choose canned food, try to get the low sodium options when they're available. But I think the main take-home message is to just really focus on eating whole foods. Whole foods are naturally low in sodium. A lot of people say only eat food that your grandma would recognize as food. And I think that's really sound dietary advice. I think, we can't discount the role of government in the food industry. The foods that we eat and why we choose to eat the foods we eat is very complex. And often the responsibility falls on the individual to make the diet change. But, there should also be responsibility on communities, on stores, on government. It's really a multi-pronged approach. There should be restrictions on marketing and advertising to kids, a lot of times, and there's a little bit of this, but, when kids watch television, they see commercials for foods that they want to eat. This is problematic. Nutrition labels should be clear and easy to read. There should really be investments in healthy foods for communities, that are sustainable. So, around schools, don't have pop machines in the schools, limiting junk foods that are available at convenience stores that are located near schools. There's been some talk about taxing unhealthy foods. Right now in Seattle, we have a sugar sweetened beverage tax. So we tax cigarettes, and this was helpful. So when prices of cigarettes went up, then smoking rates went down. So this can potentially be done with unhealthy foods and beverages. And also, just like there also been government policies that are targeting specific nutrients in foods. So, removing trans fat from processed foods, lowering sugar content of foods. So, you know, it's really not only individual diet, but the food environment, and all this is complex. And, you know, research on these other areas is really in its infancy. But there has been a shift in focusing on what people choose to eat to the food environment, which is a step in the right direction. And I'm happy to answer any questions.